Delegates from government, civil society groups, international experts and representatives of pharmaceutical industries have gathered for the Second World Health Organization Forum on fair pricing of medicines. The forum explores ways to help the pharmaceutical industry improve access and affordability of medicines. To discuss this further, I'm joined by Anele Yawa, who is the General Secretary at the Treatment Action Campaign. Good evening, Anele. Thanks very much for your time. I mean, when you sit alongside these powerful, groups, like the pharmaceutical industry, do you at these forums, do you feel that your voice does, in fact, get heard?
Good evening to you, Podvuyo, and the viewers at home. I think the question that we need to ask ourselves is not about whether do we feel or our presence is felt or not. The question we must ask, which power do we have as the people? Because at the end, for us, it is all about the power the people holds and how do we use that power coupled with the constitution and all the existing laws in the country and global. So that's why as civil society, as the public healthcare users, as the people of the world who are denied access to effective and affordable medicines because of these high and expensive medicines prices, we feel that this is unfair and our voices must be listened to. We need to put pressure to our government. We need to put in institutions like World Health Organizations as well as pharmaceutical companies as well, so that we bring to everybody's attention to say, if we are saying health is a fundamental human right, how do we make sure that everybody globally is exercising that right, irrespective of gender, creed, nationality, affordability, class, and all what have you? Because as it stands now, many people across the world are dying because they cannot afford to pay for the prices of these medicines, more especially when you're talking about HIV, TB, as well as cancer drugs. Many people outside, they cannot afford to buy these expensive cancer drugs. Let's take a typical example for a cancer drug called trastuzumab. It is costing about 500,000 rands, $500,000 a year. How do you expect a poor person to afford such an expensive medicine? That's why now we are saying, pharmaceutical companies, listen to the poor people. Pharmaceutical companies, don't put profit before the lives of the people.
Are they listening?
They are listening. If during our fight against AIDS denialism and access to antiretroviral treatment in South Africa and elsewhere in the world, we forced the pharmaceutical companies to listen to us. We forced them to lower the prices of antiretrovirals. We engaged and we forced our governments as well to change policies. It means even this time around, we are going to use the same strategies, the same energy we use during the time of access to treatment for ARVs. We're going to use it for cancer drugs, for TB drugs, and other effective medicines.
But is that happening? In other words, is the tide turning? Are these pharmaceutical companies realizing that they've got to do the right thing? When you sit alongside government, is it pushing, hard enough to ensure that they get listened to, or something akin to what you correctly say happened under the Mbeki administration actually does happen? Is that happening?
One, we must understand that the pharmaceutical companies
will always push back.
At the capitalists, they will always push back. And why are they pushing back? It is because they are protected by some of the existing laws. In 1995, the World Trade Organization convened a meeting of member states. That's where TRIPS agreements were signed. TRIPS stands for Trade-Related Aspects of Intellectual Property Rights. Through that TRIPS agreements, these pharmaceutical companies are protected by intellectual property rights and patent laws. What are these intellectual property rights and patent laws mean? It means, Podvuyo, if I invent this paper, I will be protected under the intellectual property rights for some time. No one will compete with me. And then moving forward, you benefited from this drug for about 20 years and you didn't have any competition. Then when this term comes to an end, you use the same ingredients in this drug. Maybe you change one or two and you change the name of this drug. You call it with another name. So those are the monopolies that are being used by pharmaceutical companies to keep on exploiting the poor people, but also denying the majority of the poor people access to effective medicines.
Mm-hmm. But what I was trying to get at is, yes, I mean, these issues, the issues you're raising have been there for the longest time. But considering that you've been meeting, like since yesterday, with all these other people, the pharmaceutical industry, government, and so on, do you feel that you're being listened to, which is a question I asked right at the beginning? Is the tide changing? You know, have they moved? You know, from the hardlining that they've been doing all along? Are they listening to you?
We are being listened to, but the question should not be about being listened to and no action is being taken. So there are a lot of barriers that are existing. As I have mentioned, some of these barriers are the existing laws that we think that there must be flexibilities that needs to be applied in those laws, but also there is a need for a political commitment, more especially from our governments, as to say, how do we use these patent laws? Which powers do we have as governments based on these patent laws to force some of these pharmaceutical companies to reduce the prices of these medicines? But also in South Africa, we've got institutions like SAPRA, which replaced the Medical Research Council. The question we need to ask ourselves, when are some of these drugs coming to the market? Because SAPRA as well is scared of bringing these medicines to the market because they are fearing a pushback from the same pharmaceutical company. So the question is why do we have SAPRA if SAPRA is not going to exercise powers vested in them? So there are a lot of barriers, but also, as I am saying, yesterday we have submitted, we had a picket yesterday where we submitted a memorandum to a representative of the World Health Organization, where in our memorandum we are reminding them about number of constitutional rights of the people across the world, including the Sustainable Development Goals, including the universal health coverage, which we feel that if we're talking about access to quality healthcare services, there can be no access to quality healthcare services if there is no access to affordable medicines. Because people, when they go to hospitals, they need to get medicines in order for them to be cured. So if these medicines are expensive, how do we exercise our right and the rights that exist there in the world? We've got your WHO, we've got our governments. How do they use the Constitution also to make some changes in terms of patent laws and intellectual property rights in our own countries? So that's what even the South African government is busy doing now to amend the Intellectual Property Act.
Okay, that's what we're going to leave it for this evening. Thanks very much for coming through. Anele Yawa, who is the General Secretary of the Treatment Action Campaign on civil society struggles to really tackle the high costs of medicine for the poor.